So the dangerous and deadly coronavirus sweeping through parts of China has been declared, of course, a global health emergency by the WHO. While the vast majority of known cases are still isolated in China, it's already traveled to many other countries, of course, including here in Canada. But as the disease spreads, so does the fear, the division, and there's a lot of misinformation. So what does a global health emergency really mean for Canada? Is there a plan yet to quarantine people who have the virus or who are coming back from China? And what do you need to know to keep yourself safe? Let's find out. Joining us now is the Health Minister, Patty Hajdu, and I appreciate it's a rolling situation, so thanks for being here. Since the WHO declared this a public health emergency of international concern, what new measures has Canada taken?
So, as I've mentioned before, Dr. Theresa Tam, who's our Chief Public Health Officer, sits on the World Health Organization Committee and provides an expertise to that committee, and has been abreast of the situation before it was even really being spoken about in terms of the global epidemic. And so we're very pleased that she's been giving advice to Canada that we largely learned during the SARS experience and since the SARS experience to ensure that our systems are working well together. And so we are already exceeding the recommendations of the World Health Organization in terms of our own domestic preparedness. And the recommendations really focus on how countries like Canada, who have a very sophisticated surveillance and detection system, can help assist preventing the spread to other countries that maybe don't have.
Because the concern for some people was when we had the first case was a guy that came from Wuhan, he exhibited signs, he got through the enhanced screening, and then he realized, oh my gosh, I have some symptoms, I'm going to self-report. But it relied on him to self-report. How did he get through the initial screening, and would he still be able to do that?
Well, what we know about the disease right now is that the disease is not contagious during the time where people are not exhibiting symptoms. And so, in fact, he came through the international airport where we already had an elevated level of surveillance and information for people. So, in fact, he checked off the box that he had recently come from the region of Wuhan, right, which triggered an interview with the CBSA professional who was able to then tell the passenger exactly what to do if he started to exhibit symptoms based on his travel history.
Even with now a human-to-human transmission case in the United States, as you know, in the Chicago area, should that guy have gotten through? Like, should we have had another system where it says, sorry, we got to quarantine you?
So, in fact, the system worked exactly as it should, and it demonstrates just how efficient our system is. So what happened was the passenger returned home. He started to develop symptoms that were worsening, and he said, when he called for help through EMS, I've recently traveled to Wuhan, immediately triggered a response that the providers would show up with protective gear and alert the receiving hospital. So he did exactly what we would hope would happen, given the enhanced surveillance that we have.
But the U.S. on Friday declared this was a U.S. public health emergency, and they took new steps. They say people will temporarily be suspended from entering the United States if they've come from China, and especially those areas. All foreign nationals who have traveled to China within the past 2 weeks will be detained on entry. So they've upped the game. Will Canada follow suit and copy what the U.S. has done?
So I can't speak to other countries' decisions around how they're going to manage international travel, but we're following the recommendation of the World Health Organization, which actually indicates that no further travel bans or trade disruption should occur, and that what we should be doing instead is exactly what Canada is doing right now, which is doubling down on our systems of surveillance and then protection in the case of an infected individual.
But so they are banning foreign nationals who have traveled to China for the last 2 weeks temporarily. Will Canada suspend airlines going to China, as some countries, including the U.S., have done?
That is not a recommendation of the World Health Organization right now. And we have been taking, as I said, measures to ensure that we have a responsive system and that the system is working. And in fact, the risk remains low to Canadians. I will remind the Canadians that the fact that we've been able to detect people that do have a positive, that do have the virus in such a fast manner indicates to me that, in fact, at all levels of government, we have a system that's responsive, that's taking its responsibilities seriously, and that's working effectively together.
But Minister, let's talk about the Canadians in China. A lot of Canadians are wondering how the U.S. got so many of their nationals out. Other countries, they've had planes come in and out. It's taken much longer for Canada to get our foreign nationals out. And our diplomats who are not in the hot zone or the quarantined area, they're coming out. Why has Canada lagged so far behind the U.S. and other countries in repatriating our nationals from Wuhan?
So I'll speak first of all to the people that are visiting the area or that are Canadians that are in the area. As a matter of fact, at the beginning of the crisis, if we can call it that, at the situation, we didn't know really how many people were there because not many people had registered with the Global Affairs website or the consulate services that help us track who's where in the world. And so when we started talking about the need to make sure that you let Global Affairs Canada know if you're in the region, we saw a real increase in numbers. And that allowed us to begin to understand what the nature of the help was that people were seeking on the ground. So, for example, not all people that are in the region want to leave, and part of that has been changing.
But some do, and the U.S. got theirs out, many, many days before.
And they had a far greater number of people that they actually knew wanted to leave. So we are now responding to this demand
But it's raised the question, because we have a very strained relationship with China now over the Huawei situation, over the Canadians who are in jail there. Some have asked if China's now, it's difficult to work with China, that they're not cooperating to help Canada in the same way with other countries because we have a strained diplomatic relation. Is that true?
In fact, not at all. I know my counterpart, Minister Champagne, spoke to his counterpart in China just last night. They've had a very good conversation about the process in terms of repatriating Canadians. China is doing its utmost best to contain the spread of the disease. In fact, they've advised us in terms of their criteria for people to leave the country, one of them being that people can't be sick with the virus because of their due diligence to contain the spread. And they've offered to support us in making sure that we locate people to get them on the plane.
Okay, but I hear China won't allow sick Canadians to travel back to Canada. So what happens if a Canadian national is sick there? How will they get back?
So right now, all of the people that are asking for support to come back to Canada are not ill, and we'll have to assess that as the situation evolves. If Canadians become ill and are not able to travel, we'll be providing them support while they are there in the region.
And Minister, what about is there yet a plan in place for Canadians who may get this? If more Canadians either return home, is there a place that they're going to be quarantined? There's a military base in the United States. Do you have a plan of the where, when, and for how long people would be quarantined? Do you know those answers yet?
So right now we're working on a plan in terms of where we'll bring people. Obviously people live in all different parts of the country. Some people may not even have a residence in Canada because they've been working in Wuhan or Hubei, or they've been there as a student. So those details are getting worked out as we speak.
All right, I got to leave it there. I know it's an evolving situation. I appreciate your time. Thank you, Minister.
Very much.
That's Minister Patty Hajdu.